In this video, I'm going to focus on some of the big fears that people have around medications and the questions that we get oftentimes when people are thinking about but really nervous to start medications. In general, it's good to note that we can address most of these concerns, and there are real practical, honest answers to these questions, and it makes sense that you're having these fears. And that's why it's good to meet with a psychiatrist and have a good discussion before you make any decisions, one way or the other. Will taking medications change my personality? In general, medications are not meant to change your personality, unless perhaps your personality is a little bit more anxious. Like, to the extent to which anxiety feels like it's part of your personality, we will be turning the dial down on that, but not off. The goal is not to get rid of anxiety, it's just to make you less anxious. And so maybe that means that you don't come off as quite as high-strung to others around you when you're on the medication. For people that do feel like it changes their personality in some negative way, that's not okay. And so we would just stop the medication or switch to something else. And that is not common. Will medication change my brain? Medications do make changes in the brain. That's kind of the whole point. If we weren't making changes in the brain, then there'd be no reason to give the medication at all. But also, many things change the brain. Psychotherapy changes the brain. Eating a quesadilla changes the brain. Watching this recording changes the brain. The brain is constantly evolving, changing, sending signals, releasing chemicals, and that's just how our brain lives and functions. The medications specifically increase this one chemical, serotonin, at least for most medications, and that is the change. That change is not a permanent change, and so if you stop the medication, your brain looks just like it did before being on the medication. This is not something that permanently impacts the brain in any way that we've ever been able to detect. It is important to recognize, though, that yes, we are making changes, and that's the goal. Isn't medication just a band-aid that doesn't address the real problem? Medications for OCD and anxiety-related disorders are treatment, not cure. What I mean by that is we don't have an antibiotic. I can't give you a 10-day course of an SSRI and have you be cured of your OCD symptoms. I actually do hope that we have something like that someday, but there's not in the foreseeable future. What we have instead is treatment, something that if you take the medication, it brings down your symptoms, and if at some point in the future you decide to stop the medication, it stops working. For many people, they find it really worth it to be on the medication because they just feel better and are able to function in their lives and live a life that looks a little bit more like the people around them. For others, they use medication in the short term or kind of intermediate term in order to help them make progress in therapy, and eventually they decide to go down on the medications or even off the medications and see how it is. For some of those people, they can stay off and feel fine and feel good about how things are going, and for other people, not as much. The best way to think about this is it's kind of like a blood pressure medication or a cholesterol medication. These are medications that people do take every day for a health condition that improves that condition, but it's not the only thing they can do. They can also work on diet, lifestyle, exercise. All of these can have an impact. Same with OCD. Medications can play a role, therapy plays a role, life stressors play a role. So it's really about part of a package. Will I become addicted to OCD medications? The medications we use first and second line for OCD and related issues are not addictive medications. With addiction, we see people needing more and more of a medication over time in order to get the same benefit because they build tolerance, or you feel cravings, or even have other areas of your life impacted. And we don't see any of that with the SSRIs, for example. Instead, it's much more of a treatment like a blood pressure medication. There are certain medications in psychiatry that have addictive potential. This includes things like benzodiazepines, Xanax, Valium, for example. And so we have to be really careful with those, and we often don't prescribe them for that very reason. That is not the case when it comes to SSRIs and the first-line medications for OCD. Do I have to be on medications for the rest of my life? Nobody has to be on medications the rest of their life, just like nobody has to be on medications at all. It's always going to be a decision that you get to make based off of what you feel is right for you, or that you want to try, experiment, see how things go. When we're talking about starting medications, this is not a marriage proposal. Think about this much more like dating. You're gonna try it out, see how it goes for a while, a few weeks, a few months. If you get in a fight, it doesn't work out, swipe left, move to the next. Work with your provider to stop the medication or try something else. But if it goes well, then you can just decide, do I want to keep dating it or not? But this is not a lifetime contract. Nobody decides for the rest of their life in this moment, and you can always change your mind at some point in the future. It is important to recognize that it's also not a one-night stand because the medication doesn't work that quickly. When you're feeling ready to try medication, it's because you're really willing to give it a go and see how things are for a few months, recognizing that if it doesn't work out, you're not locked into that. Is taking medication a weakness or a sign that I'm not strong enough to overcome OCD on my own? It's really important to recognize that OCD is a medical condition, one that is chronic and that if left untreated has a negative impact on people's lives long term and often affects the lives of people around them. Treatment is very important for people to get to a space where it's no longer ruling their day-to-day lives. That treatment could be psychotherapy, it could be medications, or it could be both. And it's really just luck of the draw who you end up being. If you're someone who can do just the therapy and feel better, just the medications and feel better, need both in order to feel better and to live better, we don't really know in advance in many cases. But it's very similar to somebody who has high cholesterol that shows up in their 20s or 30s. They may lose a bunch of weight, change their diet, and they still just have that high cholesterol. Many people with OCD do all the right things, do all the work, push themselves, but they still just get the urges and it keeps coming back, and the whack-a-mole game with OCD continues until and unless they decide to be on medications. It is purely luck. It is not a sign of weakness. Will medications make me impulsive or cause me to do something bad? Medications for OCD are not known to cause impulsivity. If anything, they can often decrease impulsivity because people feel less agitated, less restless when they're less anxious because of the medications. What about benzodiazepines as needed? Benzodiazepines include medications like Ativan, Xanax, Valium. These are all medications that do work for anxiety, and they work right away, pretty much within an hour of taking the medication. However, there are risks. They can cause rebound anxiety, meaning people are more anxious after they took the medication, for example, the next day, than they would have been otherwise. They also build tolerance, where you need more and more of the medication over time to get the same effect. They can have some withdrawal as well. This is why we're very cautious about the use of these medications and instead prefer to focus on daily medications like SSRIs. The other feature to be aware of is that with OCD and anxiety-related disorders, avoidance becomes a big part of the picture, and compulsions are another way of doing an avoidance. For example, you feel triggered, you do the compulsion, you feel immediately better, or you do the avoidance, you feel immediately better, but then it comes on even stronger the next time. Same thing happens with benzodiazepines if you take them as needed, meaning that if you start to feel triggered, you start to feel an urge, you take the benzodiazepine, your brain starts to think that you need that, you needed to take that rescue medication in the moment in order to survive, in order to get through the experience. And so you develop even more of a dependence, and your symptoms can actually get worse over time. This isn't always the case. It's really important to discuss with your healthcare provider. There are some limited roles for benzodiazepines in treatment for certain situations, or for example, when we're transitioning someone onto medications in certain situations. So please discuss it with them. Is the dose for SSRIs higher for OCD? For better or for worse, we do often need higher doses of SSRIs or similar medications when treating OCD. We don't totally understand why this is, though there are some hypotheses out there. But regardless, we're still trying to find the lowest dose that works for you. So when we start a medication, we'll start a medication of your choosing at a dose that would be tolerable to you. We wait maybe a month, see how you're doing, and then you get to decide whether you want to go up to the next step. And then we keep doing that process until we would reach the maximum, which is often above the FDA max for normal depression treatment with these medications. OCD will go up to 1.5 or even 2 times the normal upper limit, and many studies have shown that that's both effective for OCD as well as safe. Will reducing my anxiety with medication make me more likely to act on my obsessions? Anything is possible, and it's always important for us to have a maybe in mind when we're dealing with OCD. But in most cases, you are actually less likely to act on your obsessions with these medications. That's in fact what all the studies show. That's what my clinical experience shows. When you take these medications, the urges are less strong, there are less sticky thoughts, and the compulsions are easier to resist. What if I had a bad experience with medications in the past? If you've had a bad experience with medications in the past, it's important to discuss the details of that experience with your healthcare providers so we can get a thorough understanding of what happened, come up with a hypothesis for what drove the bad experience, and think about how to adapt treatment going forward. Whether that means maybe medications aren't the right choice for you, or we need to start a lower dose, or we should try a different medication than you tried last time. We have a lot of options, and that's why you want to get into the details of that experience. One of the most common things that I see is people who were started at too high of a dose, had a panic attack or other symptoms that were not tolerable, and got spooked from the medication. This is why we often start with very low doses as OCD specialists, and why it's important to meet with an OCD specialist. What if contamination fears or other obsessions make it hard for me to start a medication? Obsessions and anxiety and fears in general can often get in the way of starting treatment. The irony is that the medication's there to help you bring down the anxiety, but you do have to do a little bit of management of your anxiety to first start the medication. We like to take this on a case-by-case basis, so let's explore what the fear is. Talk with your provider about if your concerns are related to swallowing a medication, side effects of a medication, whatever it may be, so that we can help create as much transparency as possible so you know exactly what the risks and benefits are that are likely. Also, help to do some psychotherapy to understand that risks and benefits are part of any decision, including not taking any medication, so that you can help weigh these decisions. And then we also have little tricks we can do. For example, we can have you take that first medication, if you're ready and willing, during a visit with us as an in-session exposure. You can also do this with your therapist. What if I've tried every medication and nothing has helped? If you feel like you've tried every medication out there and not getting any benefit, that's unfortunate. One of the nice things about OCD treatment is that it is generally quite treatable with medications. And so we often see people get a lot better as long as they can get to medication at the right dose for a sufficient amount of time. The first step that we do in evaluating what's happened in the past is make sure that the trials you had were adequate. Is it that you've tried every medication at a good dose for a long time, or you were started on medication, had side effects, moved to the next, and you never really got to a good dose? If you have, however, been on good doses of medications for a long time and tried many of them, we'll first, of course, see if there's anything that you haven't tried that maybe has worked and consider that and discuss the risks and the benefits of that option, as well as non-medication options. Psychotherapy being the most obvious, but also in certain cases, DBS or deep brain stimulation, or the less invasive TMS or transcranial magnetic stimulation, meaning using magnets to help with the OCD.